Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant. This week we're going to kind of switch gears on our blogs and talk about something a little bit more controversial. We're going to talk about and identify the difference between stroke and chiropractic. A lot of chiropractors have this controversial topic, whether chiropractic manipulation can cause stroke. If you've heard over the news over the past several years, there's been stories that have been told on the news saying that a patient died following chiropractic manipulation due to stroke. So I'll kind of break down those stories a little bit and hopefully clarify things a little bit easier. But first, let's talk about what stroke is. There's two different types of stroke. First one's an ischemic stroke. An ischemic stroke is when there's a blood clot in the brain and it causes there not to be enough blood flow, causing that stroke. The other one is a hemorrhagic stroke. A hemorrhagic stroke is when a blood vessel ruptures and causes that stroke. An ischemic stroke is far, far more common than a hemorrhagic stroke. Now, what are the symptoms? Now, for both, they're the same thing. You can't identify which one is which without getting an MRI done. A lot of patients that have had strokes that have survived say they had the worst headache of their life, blurred vision, double vision, slurred speech, face drooping on one side, the inability to use one side of their body. And another common one is they can only smile on one side, because that face drooping. And the other one is they can raise their eyebrows. That's a big thing. There's another disease called Bell's palsy, so that will be able to identify the difference between a stroke and Bell's palsy. Now, what is the next step that we need to do in order to determine if a patient that comes into our office is someone with just neck pain or having a stroke? Big things that make it very controversial. We see the same thing that stroke patients have: severe headaches, blurred vision, double vision, neck pain, back pain, all very common symptoms and the same symptoms that you see in a stroke patient. You have to do an exam. And this video is not just for patients, it's videos for doctors too. You want to do a exam on every patient no matter what. We will not adjust the patient without doing an exam. So that consists of x-rays, it consists of a neck exam or low back exam, whatever the case may be. In neck patients, we go a little bit further and we actually listen to the blood flow in the carotid arteries, in the subclavian arteries. And then we also do a specific test that tests for stroke. And if that person is positive, we're not going to be adjusting them. Another big thing, and we do this with every patient, is you want to take vitals. You want to take their blood pressure. You want to check their pulse. Someone who has a blood pressure of 220 over 160, yeah, I'm not adjusting you. You're going to an ER because we suspect there could be a possible stroke. Once that patient is past that exam, yeah, I will gladly adjust that patient. But we will not adjust the patient until the exam has been passed. So what is the controversy? Studies show, not studies, but media has showed that when someone gets adjusted, that it could rip the vertebral-basal artery, which goes all the way up to the brain. There is no human force possible that can be done. And how I can prove that is in the blog that I posted this week. There's two of the biggest studies comparing stroke and chiropractic manipulation. Both studies conclude that there is absolutely no evidence and no possible way that chiropractic manipulation can cause a stroke. So that is the biggest concern that patients have when they come to a chiropractor for the first time. They're afraid that a chiropractor will cause a stroke. If you know anyone like that, have them read those articles. They are very, very, very informational articles. And another thing too, have them listen to this video and realize that we're going to do an exam on a patient. We're not just going to put you on a table and get you adjusted. We're going to take our time and see exactly what is wrong. Because if we do have a patient that could be a possible stroke, yeah, we're going to send you an ER. We're not going to say, okay, in the meantime, let's adjust you. No, I'm going to send you to an ER, to a hospital, and we're going to go from there. So that's all I have for you guys this week. It's not so much about our practice or about care. It's just about what needs to be done in case a patient has a life-threatening issue like that. So that's all I have for you guys this week. If you have any questions, feel free to give me a call. Enjoy the nice weather we're having the next couple days, and we'll see you in next week's video.